Who referred you in?
Dr. Johnson in Houston.
Oh, is that right? Yeah, he's great, isn't he?
Yeah.
Yeah, I'm glad he sent you in here. I'm looking forward to helping you.
Okay.
So if you had a laundry list of complaints,
Okay.
that, you know, anything that's really bothering you, but starting with the most severe first,
Okay.
go ahead and tell me those.
Well, I think the thing that bothers me the most is like right here in my
And your mid lower back
lower
there?
back, yeah.
Okay. And on a scale of 1 to 10, how bad is it right now?
It's about a 3 right now.
And at its worst?
7.
7?
Mhm.
Okay. And how long has that been going on for?
No, it's high school, like 40-some years now.
Okay.
And then sometimes I'll get, shoot around to my side here too,
Did you have an injury in high school or did
Yeah.
Okay.
playing football.
Playing football?
Yeah.
Would you go to the hospital for that or is it?
Yeah, I had
They
2
did.
compression fractures down in my
Okay.
T11, T12, they told me.
Did you lose any function in your legs at that time?
No.
Or any trouble? Any
No, just
tingling
hurt
or
like hell.
numbness? Okay. Just any tingling or numbness in your legs or
No.
anything like that?
No.
Okay. And then, have you ever lost bowel or bladder function?
No,
No.
Mm-mm.
Okay.
no.
And then no difficulty walking or anything like that?
Well, I have pain in both of my feet from peripheral neuropathy, so walking's not really that comfortable for me anytime.
And on a scale of 1 to 10, how bad is that now?
My feet pain, it's probably about a 5 right now.
5, and that's worse?
No, I can get up to 8.
8? Oh, wow, okay. Alright, that's perfect. Okay, and besides your lower back, do you have any soreness or stiffness in your middle back?
Yeah, occasionally up between shoulder blades.
Between your shoulder blades?
Mhm. And sometimes it'll cramp up there too. Muscles feel like they cramp.
And is it bothering you right now on a scale of 1 to 10? How
Yeah,
bad?
it's about a 3.
3?
Mhm.
And that's worse?
I can get up to an 8 as well.
An 8, okay. And then, do you have any stiffness or issues with your neck at all?
I do actually.
You do, okay.
It just gets stiff and sore if I'm on the computer a lot or texting a lot or sleep wrong. It'll get stiff and sore.
Is that ongoing?
Well, it happens, yeah, probably for the last 20, 30 years.
Has it, okay.
Right, there you go. Good.
And on 1 to 10 on that one, how bad is it?
Oh, my neck's about a 2 right now.
Okay. And it's worse?
Now I can get up to a 5.
A 5. Do you ever get any headaches with your neck pain?
Very seldom.
Every once in a while?
Maybe once or twice a year.
Okay. When you get the headaches, how bad are they? 1 to 10 there?
Well, I think probably my worst one's probably a 7.
A 7?
I don't have one at all right
You
now.
don't have one now, 0?
Yeah.
And then with those headaches or any of your neck discomfort or anything, do you ever have any tingling or numbness on one side of your face?
No,
Any weakness, like in your face muscles or anything like that?
not that I've noticed.
You know, like slurring or your drool out of one side of your mouth ever?
Except when I've drank too much.
Sure, yeah. You and me both, yeah. Do you ever get any vision troubles, like double vision or?
No, I have to wear
black
reading
spots?
glasses now that I'm getting older, but no
Okay.
blurry vision.
You never lost vision in one eye or
No.
anything like that?
No.
Okay. And then, I think that's it, yeah. Did I miss anything?
I would get nauseous when you have your neck.
Oh,
pain.
nausea. Do you have any nausea
No,
or vomiting with your
No.
headaches?
No.
Okay. And then I think I did that all
Mhm.
right. So then, and then in the
I always
past.
ask about balance too.
Oh yeah, you ever get off balance or feel like you're gonna? Have you
Well,
ever
sometimes
fainted?
I get some balance problems with my feet. pain,
Okay.
But I don't know that that's due to my back.
Have you ever passed out or
Fainted?
fainted like anything? You get
No.
lightheaded or dizzy?
No, not really.
Okay.
Mm-mm.
Okay. So that's good.
It's good, yeah. So you just ruled out the most important contraindication
Right.
of all, which is that spontaneous cervical artery dissection.
And I just write that down here, right? Yeah.
Yeah, I would, yeah.
Yeah. So.
And then no bladder valve dysfunction, no foot drop. Because that also rules out cauda equina. Oh, excuse me. How did we get up so early? We were up at 2:30 this morning.
Well, yeah, I didn't go to bed till 1.
Well, I
Trying to
went to
stay
sleep
on my
by 8
California
o'clock
time.
for me, so
Uh,
I know. You gotta do my research. How many hours is that?
6.
6 hours sleep.
mhm.
I usually function okay on 6 hours.
Yeah, me too.
I get about 5 in.
Do you?
Mm-hmm.
You stay up late?
A little bit.
Do you?
Mm-hmm.
I just tired from the day, so I can conk out.
Alright, so we rolled out all those things with the neck pain, headaches, or nausea and vomiting. Negative, okay. So, based on the history and the examination, or the history and the consultation,
Mhm.
it's okay for us to proceed to the examination to
Yes, sir.
see if you qualify, to be able to do these procedures that we do in this
Absolutely.
office. And if you don't, though, I won't be able to treat you today. I don't take every
Okay.
case that comes in,
Okay,
and I need to make sure that we can,
fair enough. I'd rather you be thorough.
yeah.
Yeah.
So let's go ahead and proceed with the
Okay.
exam, okay?
Yep.
And then here we start with just general compression, right?
Mm-hmm.
So, as it pushed down here, does that hurt you at all?
No,
No pain there?
no.
Okay. And then, what about when you go
I go
right into
back.
femoral compression?
Yeah.
So,
Oh, that one's a little sore right there.
right there, okay,
Mhm.
and then this way,
Same thing on this side.
okay. And then as I lift you up here, does that give you any relief?
Let's give you 24 hours. Stop that.
Yeah.
That feels good.
Like Dr. John says, you're gonna love me then.
Yeah, that's right.
And then turn your head, or tilt your head this way. Any pain, stiffness there?
That's a little stiff, but it's not painful.
Stiff, okay, do this side,
That's stiffer.
okay. And then, I'm gonna have you go like this for me.
Okay.
And then push up here,
Okay.
and then push up here. And if they are weak there, you'll go to the
Then I
rest
would
of
do the
them.
biceps and triceps.
But you don't do
I don't
that
do them otherwise.
as a whole, okay.
No. Because I really didn't have any ridiculous complaints either.
Either, yeah, but if you did, maybe you just check them as
Yeah,
you
exactly.
go, yeah.
You follow the physiological and pathophysiological process.
So you go here, bicep,
Yep.
good.
And then I just
You just go like, which is here, right?
well, I hit it here,
Hit it
but I
there.
always hit it with the fibers. It works better.
Yeah. And then the tricep.
And then I just hit it from there, and you don't even have to
You
move.
don't have to move, you just
Yeah.
feel it.
Right.
I like this thing.
Yeah, me
We're
too.
gonna buy one of these.
It's a pendulum.
Pendulum. So if you get any of these, you just make a note of it.
I just
It's
put
not
like a
contraindication.
plus one,
Mhm.
you know,
It's not a
Achilles or plus
contraindication.
one, the patellar.
You ever get any pathological with clonus?
I've had hyperreflexia before.
Mhm.
I always follow that up with a Romberg to see if they
Okay.
tilt to that one side, and I also did the Babinski.
Mm-hmm.
So if they've got true upper motor neuron, they're gonna have a positive Babinski and a positive Romberg.
Right.
So,
And then you're sending them.
and
for
then I send
imaging.
them off to the neuro.
Yeah. Neurologist?
I send them to a neurosurgeon.
That's what I would do, okay. That's what I thought.
I just do neurosurgical consult, evaluate and treat, you know, that way
Right.
it's all in his court now.
Right, okay.
And you've done your due diligence as a licensed chiropractor.
Yeah,
To make that proper referral.
okay.
Yeah, that's good.
And then lay face down here.
Okay.
Did I miss anything?
Well, I just do posture first. but
Oh,
those first two.
no, let's do posture. I'm gonna do it in order, just so I can watch it over and over again. Alright, we're gonna check your posture, so go ahead and close your eyes and then tilt your head forward and back. Yeah, so I see that this ear is higher than this ear,
Okay.
and then this shoulder is higher than this shoulder.
Mhm.
Right, you see that?
Yep.
And your head's a little rotated to the left there.
Okay.
And then on this side, your pelvis is shifted this way. You have
Yep.
less room here than you have here. You see that?
Which is a what?
That is a,
Use these
it's a
guys.
S,
negative SX. So you go away
Negative,
from
you always say the plus or minus first, right? So
negative, right.
SX.
Right,
pelvis.
which means right translation of the pelvis.
Right, okay. And then this would be with
Positive.
this. So,
This way, right?
yeah, so a
Positive.
Y.
No.
A positive X.
Yep.
I got it.
X-axis.
Positive.
I used this a lot
Yeah,
when I first got
I'll
started.
keep doing it. Yeah, positive.
It's with
Positive.
negatives
It's
away
on
from
the
it.
X-axis.
Exactly.
So then that would be a positive X thoracic,
No, positive SX cervical.
cervical. Okay, because the head's going
Right.
this way.
Right. And then a positive theta Y.
Theta Y. So there's a rotation.
Usually the shoulder and the pelvis follow that too.
Yeah.
And I think my right shoulder is out from my left shoulder, isn't it?
Yeah, it's gone. This one's
Yeah,
on this way.
yeah. Cause that's usually from
Positive
this.
theta Y.
In fact, I did sleep on my side last night.
That's right. So then you tell them like,
I know.
you probably sleep on your side, use the computer a lot.
Yeah,
right?
too much.
You text a lot. You
Not
text
a lot, not like a lot of
You ever
people.
get those people arguing with you when you're doing their podcast?
No, not really.
Alright, so then, that we do posture. Now we're gonna do the chiropractic examination of
Okay.
your spine and pelvis, okay?
Yes, sir.
So if you're short on the left, and then you go up, and then you go long on the left, that's Deerfield positive, right?
Deerfield, yep.
And that,
If it tightens up,
that's a
positive
knotless.
knotless.
Okay. Deerfield positive, and then that tightens you out, so that's a positive knotless. And then you do your sacral raise
Yep.
this leg up, good, and then raise this leg up. And they should go even. If they don't, the harder side to raise up, that means that sacrum's posterior on that side, right?
Correct, yep,
Base posterior,
that's correct.
yeah. Okay,
I didn't cramp up on that one today either.
that's good, we adjusted you real well.
Yep.
And then do you usually palpate through here?
I just palpate with my fingers. So
Yeah,
I
you're just checking
Yeah.
tone, and then you
But
got
if you palpate like that, to check
Yeah,
out
right.
range of motion, dysfunction, that's fine too.
you got a subluxation there,
Yep.
you
Yep.
got a subluxation there, and
Yep.
then you definitely a subluxation.
Where you find the most major subluxations is the translations.
In the
My
transitional
neck
segments.
translated left, my pelvis translated
Oh,
right.
yeah.
So you would find most of mine in the cervical and lumbar.
Okay, those
Region.
global.
Pelvic region, yep.
Mm-hmm. Okay. All right, so based on our findings here and our history and exam, what I found is that you are a candidate for the procedures that we do here in the office.
Okay.
Okay, but I need your permission to go ahead and adjust you, and that you understand the risks associated that you signed on your form.
What are the risks?
There are risks associated with them, like soreness, tenderness, sprains, strains, and then there's a possibility of a stroke happening in your spine. But the research says that you're more likely to get struck by lightning than have a stroke from chiropractic adjustment.
Yeah, okay.
Okay. And I adjust you, and I adjust everything, and then that's it, right?
Yeah, you can go ahead and adjust because I don't
Okay.
think you did the biophysics on me.
That's right, I didn't do that earlier.
If you would, call out your contact point on your hand and the contact point on my anatomy too.
Okay.
And your line of drive.
Hour. Okay, so I'm gonna adjust the sacrum first.
Okay.
So I do sacral base on the left
Yep.
here.
What's your contact on your hand?
My contact is in between my thenar and my hypothenar, right? Is that correct?
Pisiform kind of.
Pisiform, okay. On the base,
Yeah.
and then my line of drive is P to A and I to S,
Just the eye.
or SI rather. Yeah, you're right. That's what I'm doing. Okay.
Good.
And then I go over
Center.
center, pisiform again,
Yep.
and then base posterior. So
Hit a little bit more S to I.
more S to I.
There you go.
Okay.
You get better separation L5 when you do that.
Yeah, I felt it. Yeah. And then I'm gonna go SI joint on.
I hit the sacrum first.
The
Right
sacrum,
sacrum.
right sacrum,
and then right SI.
right sacrum, then right SI. Same thing,
Yep,
and then the SI is a little more M to L, right?
correct.
And then my contact is more on the PSIS.
On your palm.
Yeah, in the palm, right?
Yep. Yep, good.
Good. Okay.
Good line drive.
Good.
I don't think you hit my left SI joint.
I did not. No,
And I just do those once because you start pounding them too much, they get sore.
they get sore in those joints, right?
Yeah, because you're already moving it quite a bit with those. So just once you do one, that's all you really need.
And then I'm gonna go up the lumbar spine. I'm gonna work on not popping off because I tend to do
Okay.
that.
Yep.
It's a new
Yeah.
muscle memory for me. So, and then just go to the next one.
So you still lift it up just a bit. You still. If
I
your
did.
hands pointed straight up.
I
wide,
still lift it up. No, I'm not. I'm lateral.
kind of sideways. Yeah.
Yeah. So as I do these,
I just go ahead and get back down on L5 again.
Okay.
And just hit that and just barely slide up. You just feel spinous to spinous and you stop every time.
okay.
There you go. Better. That's better.
Yeah, that felt
Much
better.
better. Yeah.
Yeah. And then here we do
I
thoracic.
do a lot of IDS on those lower thoracic.
Much more, right? Yeah.
Yes.
Yeah, and I did that better this time. I felt. So then here we just do carver or double cross biseform or whatever you. You're just freeing those up, right?
Yep. Just want to get them moving.
We switch to thoracic. And then for this one, it's like a nice knife edge hypothenar, right?
Yes, sir.
And then I start at C5.
C4.
C4.
Inferior aspect of C4.
Okay.
Spinous.
And then here, and then it's a I to S, P to A, right?
Correct. Yep.
Scoop.
Yep. Then move down to C6. Yep. Good. And then go further down to T, below T2.
Do you use the thoracic drop for that?
I do.
Yeah.
Oh, no, I just use the cervical drop.
Oh,
I'm
just
sorry.
cervical drop. Okay. And then you're
But-
more P to A on this
Come a little
T2.
lower. Yeah, get down maybe one more. There you go. Better. Because the whole purpose of that adjustment is to bring the entire head and neck up over the
Going
thoracic
backward,
spine.
yeah,
Yes.
right. That makes
Yeah,
sense.
that was good.
Okay. Let me have it on your back.
Okay. And when the patient's getting up,
And this is thoracic and or just
just
thoracic?
cervical on this one.
Just cervical?
Yeah, you gotta
Oh, I'm doing
lift
that.
up
Hands
more.
full. Yeah, I forgot that one. Alright. This is I to S.
So just go ahead and lift my head straight up first, y-axis, and then go back. Yep, better.
Like that.
Yeah, stay in tight though.
Stay in tight
Yeah, on the zygomatic.
up here.
Better. Yeah, a lot better.
Yeah, so you're.
The lift's the most important thing with that. You go Y and then negative theta X.
You're basically bringing the occiput back on.
Well, you're restoring that cervical lordosis
Okay,
with it.
okay. And then we
And
go
you're
to,
just using the table as a lever on T1.
then we go to thoracic drop. and
Yeah, if
then
this doesn't hold up on the thoracic drop, have it just scoot down a little bit because it's usually just the weight of
the
the
weight
chest.
on it. Okay.
Like,
And then you don't have to mess with your nods.
Right.
Yeah. A little bit more.
Now you crank it up a little.
Yeah, so you're down pretty low. Okay, there we go. So I'm going to chromium
Yep,
and I'm just going lateral.
straight
right?
lateral. Yep, good.
And then I'm gonna go AC. Straight lateral. And then down the ribs.
Hit these straight x-axis though. You gotta get your center of gravity over it and push it out
Over.
sideways. It's better. See difference?
You're almost like, yeah, okay.
Oh yeah. Yep.
There we go.
Good.
Good.
Oh, that's good.
Good D.
I felt that up here.
Good.
Oh yeah. Been waiting for that.
Yes, sir.
That was good.
Awesome uses awesome does.
That's it. No wonder they call you Dr. Awesome.
Yes, sir. Alright, so then we do bicep, tendon, and then bring it up and in. That shoulder. There you go. Good, good. Elbows, wrists.
Oh, that was good. Traction it out a little bit more, maybe.
Yeah, there you go.
You can hit it one more time for me.
Jammed up, man.
Pull it away. There. That traction's a huge component of that.
Oh, that was stubborn. We got it though.
Yep.
Oh, yeah. Whoop. You gotta get used to those.
Yep. And patients will step on those all the time too when they're just getting on the table and stuff.
Sure.
Pull it away.
Yeah. There you
Good.
go. And then, mirror image. So I'm just gently pushing down.
Mm-hmm. And sometimes, you know, if you feel like the major scar tissue areas around that lower thoracic region, I'll hit those a little bit deeper on the muscle spindles.
Okay.
Just when you're in flexion, go ahead and hit those again for me if you would. There you go. That's better. See, that relaxes those more.
Yeah.
That was starting to cramp up on me again.
Resets them.
Yeah.
All right, and then we're gonna mirror. Oh yeah, you're gonna go up and back, and then we're gonna hit here,
Yep.
and just a little tap there on that one.
Yep.
Beautiful.
I almost feel like I'm going backwards now.
Yeah, you're straightened up.
Feels
Looks
good. Steady. Yeah.
Yeah,
I corrected my posture.
I like that.
Yep.
Yeah, you definitely look a lot straighter.
If you
after
got a person that's got a lot of translation on their pelvis,
that. Yeah.
I'll do this sometimes and just shift that pelvis
Shift the
either
pelvis
direction,
over
the
to-
opposite of what they were.
Right.
It's hard to do that though, because I mean that's a fairly complicated proprioceptive move.
So
So
hold them in it.
if they're out a lot of times they won't be able to. And it just help them. Will shift your whole hip over towards your left hand.
Mm-hmm.
You know, just give them a little help.
Right. Right. Great. Awesome.
That was
You did
great.
it.
Good job.
Yeah. Thank you.
Very good.
Appreciate that.
Your line of questioning was good.
Okay.
Just follow always the anatomical and physiological pathways of what the person's telling you.
Right.
If they've got neck pain, I always says, does it ever shoot down your arm or hand?
Mm-hmm.
You know, if you got low back pain, does it ever shoot down your butt or your legs?
And then
Just follow those
and then hit those
physiological
red
and
flags,
neurophysiological
too.
pathways. Yep.
Right.
Yep. Good.
Okay.
You did good.
Yeah. Felt good.
Yep. I felt that ring dinger all the way down, so I'm gonna ring my bell.
That is a bell and a half.
Yeah. That's the real deal too.
Yeah, it is. Yeah.
Well, welcome to the team, Dr.
That's
Awesome.
my joy, absolutely.
Yes,
Yeah.
pleasure. Been a great
Yeah.
week.
Yeah,
I've
has
enjoyed
been.
it.
Me too.
Good.
Yeah, it's great to be a part of it.
And if you're a licensed chiropractor in the United States, come visit us here in Houston and learn for yourself the advanced chiropractic techniques that we teach, Johnson Biophysics and the ring dinger.
That's right.
Because it is really an advanced technique, isn't it?
Completely. Yeah. And you gotta try it.
Yeah.
You really gotta try it for yourself.
Yes.
Yeah.
Proof's in the pudding, yeah,
And
right?
100%.
Yep.
Yep.
So we'll see y'all for your ring dinger soon here in Houston and in San Diego.
Let's go.